How does autosomal recessive inheritance affect CF carriers? Imagine a game of genetic chance where each parent contributes a piece of the puzzle. Cystic fibrosis is inherited through an autosomal recessive pattern, meaning a person needs to inherit two copies of a mutated gene to have the disease. These genes are called CFTR genes, and they are responsible for producing a protein that helps regulate salt and water movement in our bodies. When both copies are mutated, the protein doesn't work properly, leading to the symptoms of cystic fibrosis. But if someone inherits only one mutated CFTR gene and one normal gene, they are called a carrier. Carriers usually do not have symptoms as the normal gene can usually compensate for the faulty one, keeping their body functioning normally. Now, if both parents are carriers, each of their children has a 1 in 4 chance of inheriting both mutated genes and developing cystic fibrosis. There is a 50% chance that a child will inherit one mutated gene and become a carrier like the parents, and a 25% chance that a child will inherit two normal genes and not have the disease or be a carrier. If only one parent is a carrier, then none of the children will have cystic fibrosis, but each has a 50% chance of being a carrier. This pattern of inheritance is important to understand for family planning and genetic counseling. While carriers do not usually show symptoms of cystic fibrosis, recent research suggests they might have a slightly increased risk for some health issues. For example, some carriers may have a higher chance of developing pancreatitis, male infertility, bronchiectasis, or diabetes. However, these risks are generally low, and most carriers remain healthy. The CFTR gene is quite complex, with over 1,800 known mutations. Different mutations inherited from each parent can influence how severe cystic fibrosis might be if someone does develop the disease. This genetic diversity explains why symptoms can vary widely among people with cystic fibrosis. Understanding autosomal recessive inheritance helps people make informed decisions about their health and family planning. Carrier testing is often recommended for those with a family history of cystic fibrosis or for couples planning a pregnancy. If both partners are carriers, they can explore options with healthcare professionals, including reproductive choices like in vitro fertilization with genetic testing or other methods to reduce the risk of passing on the disease. In summary, being a carrier of cystic fibrosis means having one mutated CFTR gene and one normal gene. Carriers do not have cystic fibrosis but can pass the mutation to their children. If both parents are carriers, there is a significant chance their child could inherit the disease. While carriers usually do not experience symptoms, some evidence suggests they may have a slightly increased risk for certain health conditions. It's always best to consult healthcare providers for personalized advice and testing options to understand individual risks better.